As many countries seem to be recovering from the worst of the coronavirus pandemic, a new threat emerged. The Delta variant first appeared in India in April 2021. By July, it had spread to 132 countries, causing new waves and massive spikes in countries like the US and the UK. What do we know about the Delta variant, and what does it mean for vaccination programs across the world? The first Delta case was identified in December 2020 and led to devastating outbreaks in both India and the UK. By the end of July this year, Delta accounted for more than 80% of new COVID-19 cases in the US. But the Delta variant is not killing more people because it is necessarily more lethal than the original strain of COVID-19. Its ability to infect far more people more quickly means that the probability of hospitalization and death in a population shoots up exponentially once the Delta variant is loose. Researchers have found that the R0 for Delta, the average number of people that one positive person can be expected to infect, is around 6. In comparison, the original R0 of the Wuhan strain of the coronavirus was between 2 to 4 people. This is why, despite not being more lethal than the original strain, a Delta outbreak can quickly run through a population and overwhelm health systems and hospitals. People who have not been fully vaccinated against COVID-19 face the highest risk of infection and death from the Delta variant, including young people and children who were previously thought to be much lower risk.
I would like to appeal to this country, to the people in the country who are not vaccinated, to realize that we have the capability among ourselves. Get vaccinated and the time frame will be truncated dramatically.
In the early stages of the pandemic, Australia seemed to be ahead of the curve, shutting borders and adhering to strict lockdown protocols, managing a minor number of cases. But being slow to vaccinate the population meant that the country was not prepared to stem a Delta variant outbreak, and the country is now experiencing a relatively huge third wave of infections. While vaccines have been shown to be efficient against the Delta strain, data has also shown that vaccine efficiency against the Delta variant drops off over time. This is the situation now facing Israel, a country originally lauded for an early and comprehensive vaccine program that began its rollout in December of 2020. But those vaccinated the earliest proved to be more susceptible to infection once the Delta strain appeared early in 2021. Those vaccinated in January were found to have almost twice the chance of being infected as people vaccinated in April. Over 50% of people who were seriously ill were fully vaccinated. This is why many countries are now considering or implementing third doses or booster shots of vaccines. But these alone cannot curb transmission. Scientists say that the only way to do this is to also return to masking and social distancing measures that many countries relaxed after rolling out vaccines and experiencing a drop in case numbers. The Delta variant caused China to experience a huge surge in cases in July after months of keeping the coronavirus under control. The Delta strain eventually spread to 50 cities, including Wuhan, which had not experienced a single COVID-19 case for over a year. Still, authorities reported bringing the surge under control in just a month. China took no risks with the Delta outbreak, reverting quickly to immediate travel restrictions, lockdowns, and mass testing. The country reportedly also reprimanded multiple public officials accused of being lax or negligent in response to the outbreak. While other countries like India and Australia have implemented similarly strict lockdown and travel measures, they have not been successful in curbing Delta outbreaks the way China has. This may be because China implemented testing on a level that has yet to be replicated by other countries. After the Delta outbreak, entire cities were subjected to multiple rounds of repeat testing, even if they experienced only a handful of cases. The city of Nanjing, home to over 9 million residents, tested everyone twice in the space of a month. In Zhengzhou, 10 million residents were tested in response to a single asymptomatic case. Instead of neighborhoods or hotspots being put into lockdown, entire cities were under snap quarantine measures. These measures clearly worked, but with the pandemic wearing on and populations around the world feeling the toll of the economic and social consequences of quarantine, it seems unlikely that other nations will be able to implement such drastic measures effectively. And while nations with high vaccine rates are now considering booster shots to curb the impact of the Delta variant, what will the future of the pandemic look like in countries that have yet to get hold of their first batch of vaccines?